Proper food care can prevent the diabetic food problems or treat them before they cause serious complications. You know, diabetes can affect almost every part of your body, and then including your heart, your eyes, your kidneys, your brain, and your nervous system. I'm telling you. And then prevention is better than cure, and early detection is the key to preventing serious complications. So foot and toe ulcers or open sores are the most common types of food problems for people living with diabetes. I am living with type 2 diabetes mellitus, and what am I, or what are we supposed to do as diabetic patients? We are supposed to take care of our diabetes, and then by keeping our blood sugar under control. How are we going to do this? By following our doctor's advice regarding our nutrition, regarding the exercise, modification of a lifestyle, and the treatment that we are taking, to take it regularly and then every day as advised by our doctor. In that way, we keep our blood sugar level within the recommended range by our doctor. You know, even our doctors are following the recommendations from Diabetic Association. So we must do the same. We must comply in order for us to avoid the serious complications. So now, next, what are we supposed to do as diabetic patients who must do the daily check-ins? What are these daily check-ins that we are supposed to do? We must take care of our feet, and then wash your feet with warm water using a mild soap. You know, checking the temperature of our water to avoid burns, we must use the elbow. And then the elbow is the traditional way, and then also it's recommended everywhere to use the elbow to test for the temperature of the water. Also to use a thermometer if you have one, but if you don't have, the elbow is number one. Don't just dip your feet inside the water without checking your temperature. You might burn your feet if the water is hot. And then don't also wash your feet in a very cold water. It is not recommended. Dry your feet completely between your toes, and then apply lotion on top of your feet, not between your toes. Apply lotion on top, not between your toes. And then remember, bacteria thrive well in humid and warm area. So if you apply also between the toes, you are keeping the place warm and moist, and then which could lead to infection. Check your feet every day for any sores, for any blisters, for any color, the redness, calluses, or any color, not the redness only, any color. Just check. That is unusual. This is not your color. And then you see something, it's very strange. Please report to your doctor immediately, or any other problems that you detect when checking your feet. And then don't forget to look between your toes, because you know you'll be checking but forget between your toes. And then again, you must also look under your feet, because if you don't look under your feet, you are going to miss something. You know, you'll think that you have done the best, yet you missed some serious complication or some serious problem under your feet. So what you are supposed to do, with your standing mirror, you can sit down and then stretch your legs and look under your feet. Or you can have a hand mirror and then look around your feet. Don't miss any part of your foot, everywhere, and then under your feet, and then you look. And then if still you cannot see properly or your vision is poor, you can buy the magnifying mirror and then look around and make sure that you touch every corner of your leg. And then again, if let's say maybe you cannot do it still, or you don't have magnifying mirror, this is a teamwork of you and your family, and your family is your support team. Ask one of your family member, your husband, your wife, your children, or your brother or your sister, anybody, or your mother. They can do it for yourself. They must look for any problems. They must inspect your feet, help you with the inspection of your feet. And then again, never walk barefoot, even inside the house. Inside the house, you must wear the sandals, you must wear the slippers, you must wear the even close to shoes inside your house. And then outside, never walk with the open toe shoes, because it will be, you'll get injury very easy. And then don't walk barefoot outside the house. And then for me, I was advised by my doctor, because I was wearing some sandals, I was wearing the open toe shoes, and then on top of that, I had a nail polish applied on my toes, and then the doctor discouraged me to do the same, to do that. And then he said I must never wear the nail polish, because I won't see if my feet are getting, or my toes are getting infected. I cannot see if they're changing any color, any problem I won't be able to detect early. And then again, I mustn't wear that type of the shoes, because they were open toed, so I was going to get injury very easy. And then wear the shoes that are well fitting, not the ill fitting shoes, because if you wear the ill fitting shoes, you'll get injury very easy. You know, the friction around your leg and you know, causing the injury on your legs. So try to wear the proper shoes, and then don't wear this type of the shoes, the ones that with a sharp like this, and they are not advisable for us, because they will cause some problems like corns and all this, because you know it's going to be a problem, and the corns are very painful, and sometimes you won't even feel them because of the nerve damage. And then check always inside your sock, your shoes, when you are wearing, and then before you're wearing them, and then check before for any pebbles, for any objects, for any insects inside your shoes, because you can wear your shoes and then find that there is something inside your shoes, and then you get injured, of which is not good. And then you know, our nerve, if you are having a nerve damage, you won't even feel pain, and then you realize the problem when it's infected already, and then causing more serious complications. So now again, do not wear tight socks. The tight socks and this, or the stockings, you know, avoid socks with elastic, you know, because the tight elastic will reduce circulation to your feet. You know, sometimes you see people, when they remove their socks, there is a mark, and then also a dent around where the socks were up there, you know, and then you find that now there is a problem. You know, you are reducing the circulation to your feet, of which is not advisable. Wear the soft the socks. If you are wearing the ones with elastic, it must be the ones with a soft elastic. And then buy most of your socks from pharmacy, and tell them that you want the diabetic socks. They will show you, and then buy the ones that I recommended. And then do not protect your feet from heat. And then do not use heating pads, hot water bottles, or electric blankets. You know, I know of my friend who was using electric blankets, and she's always using the electric blankets during winter. And then she had a serious problem one day, because she failed to regulate the temperature. It was high, and then she was not aware, and then she was having a serious problem for that day. You know, if it's a hot water bottle, and then if let's say maybe it's not closed properly, because the water that we put inside, it's a boiling water, and then you can get burns. If it's not, it will spill on your skin and then you get burns. Or maybe it is you know, you have nerve damage already, and then you put the hot water bottle on your tummy or on your legs, and then you find that you have burns even unaware, because already you have nerve but damage. It's only when you look at your abdomen in the morning or whatever time you find that already you have sustained burns. And then I know of a patient who sustained burns because of that. She got the hot water bottle from her family from home. She was not diabetic anyway, but it's just like, you know, she was having the nerve damage on her abdomen, and then it was terrible, you know. But anyway, it was not the nurse's fault, it was her fault because and her family. So do not use something like that in cold weathers. Wear the warm socks, and then you can have also wear this when you go to bed anyway, and then wear warm pajamas when you go to bed, and then you can wear insulated shoes during cold weather. Any problems that you detect during your inspection, please report to your doctor immediately. Don't stay with the problem, because if you don't talk to your doctor or contact your doctor, then you'll end up with serious complications. Keep your blood flow to your feet by elevating your legs when you are sitting, and wiggle your toes, and move your ankles every time when you are sitting regularly, you know, so you will promote the blood flowing to your feet. And then do not cross your legs for a long time. Anyway, it is advised that you are not supposed to sit and crossing your legs, because it is not good for your health. As we diabetics, we have a lot of problems. And do not remove the cones by yourself. You know, I know about this because I did this, removing my cones when I was having cones, but I was not yet diagnosed as diabetic. But it was terrible because, you know, I applied the patch on my cones, and then the skin around the cones was affected. It was red, painful, and almost, I don't know how to explain. I wish I took a picture of that area. It was terrible because of the patch that I applied. It was not good, you know. So don't remember, there's the corn, around the corn there is a skin, a healthy skin. And then also I used the razor some other time to peel or to cut the corns, of which it was not advisable. I did not know at that time. I thought it's the only treatment, but now I know what I did not know, because now I know I'm diabetic. I'm trying to get more of the information about a lot of things. So I tried to peel it, oh, it was so, or cut it. I cut, I end up cutting the healthy tissue. It was so painful. I was not working for 3 days because I couldn't walk properly. So thank God I was not diabetic yet. Otherwise, I was going to have serious complications. And then trim your toenails regularly, and then and file them. Don't leave them long, and you know, it's not advisable. And then it is not good also, because we are inviting some infections and some problems that will lead to a serious complications. If you smoke, please stop smoking. Try to get help, because I know that it's not an easy way. It is not easy to stop smoking, not easy at all. So but because smoking narrow the blood vessels and reduce the blood flow to your lower extremities, so your wound, if you have any wounds and then you are smoking, and then you know that wound will not heal properly because of the smoking. Because as I said, smoking narrows blood vessels and reduce blood flow to the lower extremities. And you know, the blood flowing to our any part of the body is also carrying oxygen. So we are depriving our body with oxygen. And with nutrients, a lot of things, you know. So make sure that your doctor checks your feet during each visit or your checkup. So you must do that. You know, some of the doctors, they forget to do the checkings of your foot, of your feet. Also make sure that you have examination by the foot specialist once a year. But your doctor or the specialist will decide how often he wants to see you because of the conditions or because of the problems he identified. So it needs like a frequent or a frequent checkups